Hi, everyone. Welcome to this panel. My name is Sarah Pollitt. I am the Chief Operating Officer at Rock Health. Rock Health is a seed accelerator for health tech startups. And in the process of supporting startups, Rock Health began an initiative called XX in Health. The XX in Health mission is to connect and empower female visionaries to drive change in healthcare. So we're here today to talk about women, to talk about healthcare, and to talk about technology and the US and global markets. So we have some phenomenal panelists here to join the discussion. Amy Shang, who's co-founder of CellScope, and Leah Sparks, CEO and co-founder of Wildflower Health, and Kirsten Gautner, who's the global director and founder of Mama. So I'd love each of our panelists to take a moment, introduce yourselves, let us know what you're working on, how you got into it, and a little bit about your background.
Great. Sure. Hi. My name is Amy Shang, and I'm one of the co-founders of CellScope. We actually started working on cell phone microscopes in a bioengineering lab at UC Berkeley a couple years ago. And the focus was more on emerging markets, so doing remote diagnosis of diseases like TB and malaria in Uganda and India, Vietnam. And then about 2.5 years ago, we spun the company out, CellScope, and we're now focused on building a modern digital first aid kit that is smartphone enabled for the home. So the first product that we're planning to launch just in a couple of months is called the CellScope Oto, and it's a smartphone otoscope. This is an early prototype of it. And the idea is that ultimately, parents will be able to use devices like these from the comfort of home, take a diagnostic quality video image of their kid's ear when they think they might have an ear infection, and then transmit it to a doctor who can do a remote diagnosis. Our vision is bigger than just looking at ears, so we are planning, to look at skin, as well as other kind of most common body surface imaging problems. So we're planning to launch, and we're going to start initially with physicians and work with physicians to have them use our devices within the clinic, and then from there push into the home.
Great. Hi, everyone. I'm Leah Sparks, co-founder and CEO of Wildflower Health. Wildflower Health delivers mobile health programs through health insurance companies, and we're starting in maternity. And we're starting maternity because I think it's a perfect place to start with a real mobile healthcare platform that impacts quality and cost in a real way. A lot of people are surprised to learn that the United States has the highest rates of pregnancy complications in the developed world. We spend as much on maternity every year as we do on cancer care, and over half of those costs are associated with complications, many of which could be prevented. And what we're doing is engaging women right on their smartphone at the right time when something comes up, and we're integrating that experience into the healthcare landscape, into helping them work with their provider, tap into benefits available through their payer, to take meaningful evidence-based action right then. And we're also getting all that data from mobile phones and working with our clients to build a better model. Because the other kicker about maternity care in the United States is we don't predict about half of the high-risk pregnancies that have a huge impact on moms and babies. And so we ultimately want to have a better predictive model for informing that. And stage of the company, we're fairly early. We're about a year old, but we already have traction with healthcare payers. We'll be rolling this program out to a Medicaid state, to the entire state, a West Coast-based state in the coming month.
Hi, I'm Kirsten Gautner. I'm the global director of Mama. Mama is an innovative public-private partnership that was launched just about 2 years ago by former Secretary of State Clinton. We have 5 global partners: USAID, Johnson & Johnson, the United Nations Foundation, the mHealth Alliance, and Baby Center. And we were really created because even though there have been improvements, there's still about 800 women a day around the world who die of pregnancy and childbirth-related causes. And similarly, there's over 3 million babies who die in the critical first weeks of life every year. We also know that about 1 billion women in low to middle income countries now have access to mobile phones. So we've created an age and stage-based set of content that we get out to women across the developing world in their local language, within their cultural context, and it's really framed to cover the most important health topics like immunization, prevention of mother-to-child transmission of HIV/AIDS, breastfeeding, and a variety of other topics to get to them right when they need it. I've got a brief video that I'd like to show you that features a mom in Bangladesh who's been using the Mama service there, and I think she explains it better than I can.
ছেলের বয়স 9 বছর আর মেয়ের বয়স মাত্র 1 বছর। মানে সবাই আমরা এখানে আছি, যা ছেলে মেয়ে সবাই মিলে।
There's subtitles.
এই জন্য আমি তারপরে মানে 9 বছর পরে আমার এই মেয়ে নিচ্ছি। এটা আমার মানে বড় বাবুর বাচ্চা দিয়ে বলতেছি। আমার যখন প্রথম বাচ্চা হলো তখন আমি কিছুই মানে এসব জানতাম না যে বাচ্চাকে কীভাবে লালন পালন করতে হবে, কী খাওয়াতে হবে, কত মাস পর্যন্ত বুকের দুধ খাওয়াতে হবে আমি জানতাম না। এগুলো আমি জানি, সেজন্য আমার বাচ্চাকে অনেক হাসপাতালে ডাক্তারের কাছে সবসময় মানে অসুখ লেগেই থাকতো। কিন্তু তখন আমি জানিনি যে এভাবে বা 6 মাস পর্যন্ত বুকে দুধ খাইতে হয় বা একটু পানিও খাওয়াতে হয় না এর মাঝে। এটা সবচেয়ে ভালো লাগছে যে বাচ্চাকে যখন বাচ্চা একটু বড় হবে 6 মাস বা 3 মাস হবে বাচ্চা, তখন বাচ্চার চোখে চোখ রেখে কথা বলতে হবে। এটা অবশ্য জানতাম না যে বাচ্চা চোখে চোখ রেখে কথা বলতে হবে, বাচ্চার কথা মানে বাচ্চা ওইভাবে শিখে। মেসেজগুলো পড়ে আমার স্বামী আমাকে খুব উৎসাহিত করে যে এভাবে করো এভাবে করো। ও পরে মেসেজগুলো আমার শাশুড়ি ওইভাবেই মানে এখন অনেকটা করে যেভাবে এইভাবে বাচ্চারা কর, এভাবে মানে সব কিছু যত্ন করে এভাবে খাওয়া, এভাবে করা। আমার পরিবারের সবাই মানে মেসেজ পেয়ে সবাই আমার বাচ্চারা খুব যত্ন করে, মানে ওইভাবে আর কি করে মেসেজ যেভাবে আসে ওইভাবে মেসেজ সবাই আর কি ওইভাবে যত্ন করে বাচ্চারা। এখানে আমার ডাক্তারের কাছে যেতে হয়, মানে স্বাস্থ্যকর্মীর কাছে যেতে হয়, যে জানতে হয়। এখন আমার তা হয় না, আমি মেসেজের মাধ্যমে ঘরে বসে পাইতেছি সেবাগুলো। খাবার তারপর স্বাস্থ্য সব কিছু এভাবে আমি দেখছি মেসেজের মাধ্যমে আর কি সব কিছু পেয়ে ওভাবে আমি লালন পালন করছি।
Wonderful. Thank you so much for sharing that video, and thank you for all the background and context and introductions. So, given that this discussion is really designed to sort of explore the role that women play in healthcare, from decision making to resource allocation, I'm curious if, to caregiving as well, curious if each of you has maybe 1 or 2 examples of how women have already worked to shape healthcare, whether it's through healthcare entrepreneurship or healthcare consumerism or healthcare reform.
Sure, I can start. So for me, I'll take the healthcare entrepreneurship angle. I'm a founder of a mobile health startup, as well as a mom. And what I found in my experience of leading my company is that being a mom, as everyone knows, I'm a consumer of, I picked my child's pediatrician. I buy most of the products in our home and do a lot of the coordination. And so I think as a parent, being able to experience the pain points once you have kids has been incredibly beneficial in terms of being able to take all those learnings and intuition and experiences into my work. So at CellScope, like I mentioned, we're building a smartphone otoscope for consumers, for parents to use in the home. And one specific example that I've learned is just, as a parent, you need things to be dead simple. You need products and services to just work, preferably with one click, as simple as possible, as few steps as possible. And when we were looking at the ear infection application, the child is already sick, they're already going to be fussy, and not often non-compliant. So as part of the product development process for us as a startup, we really took a lot of care to simplify and reduce and make the entire system as streamlined as possible. So for example, early on, one of our original prototypes, the hardware had this external calibrator. It was like this cap that you had to put on the device, and you'd have to wait while it would do this software calibration. And we quickly learned that that's just completely impractical for a parent who needs to just be able to clip this onto their phone, open the app, and put it in their kid's ear and take a video. I think another specific learning that we had, where as a parent, I kind of experienced this firsthand and then was able to kind of influence the product development process, was the original prototypes really focused on taking still images of children's ears. So the idea was that the parent would need to kind of get the child to hold still and then place it, and we'd have training materials, but they would take a picture and then that picture would be transmitted. And we quickly learned again that video is really the preferred mode over taking stills, because with videos, you get to take a tour. The parent doesn't have to get it in just the right angle for the physician. And then we've also learned that as a secondary benefit, physicians actually prefer the video, because for them, they get more information. It's a more comprehensive tour of the ear. So I think it's all of those types of things that as a mom and as a leader at a healthcare startup, I've been able to directly take key learnings and apply them.
Great, and just building on that, I think I would speak to women as patients and as becoming this chief medical officer of the home. And what we're finding in working with pregnant women is, for many people, when they have a child, it's the first time they really deal with the healthcare system, both for the mom and the dad. And as a company that's delivering a program to this demographic, I've been in healthcare for over 10 years. I've done a lot of programs for different people, different conditions, and I have never seen a group like pregnant women. They are incredibly engaged, incredibly motivated. It's a dream demographic from healthcare engagement perspective. And I think if we as a healthcare system can really continue to tap into that and that enthusiasm and commitment when women are pregnant, and continue that into raising their children, feeding their family, figuring out, exercise for their family, we can really tap into something powerful that can be hugely impactful for the healthcare system. So I think that's the way women are impacting healthcare and can continue to, if we can tap them in the right way.
And interestingly, all of the points that you both made, I think, are also true for women in the developing world. So for moms in the developing world to be able to access healthcare and make the decisions about accessing healthcare, it has to be as simple as possible. And maybe for them, it's not so much about having, a high-tech device that will fit on their smartphone that they probably don't have. Rather, it's how far is it to the clinic? Can they afford transportation to get there? Once they get there, how long are they going to have to wait in line? What are their options? If they get there, is the immunization going to be available? So it's making that process of accessing healthcare as simple as possible. And for when we're looking at these different aspects and access, and also who are the decision makers, many of the cultural factors across the developing world influence whether and how women can make decisions about accessing healthcare. In Bangladesh, for example, we know that the decision maker is directly related to the level of education in the home. And the less educated the mother is, the less likely she is to be the decision maker around accessing healthcare. And then to your point too, Leah, about pregnancy being the time where women are so much more engaged, it's also a huge opportunity within the developing world. It's the time where people who might not otherwise be able to afford healthcare somehow find some way to get to the healthcare clinic, to get the transport, and to engage and to change behaviors that they, at other points in their life, maybe aren't quite as incentivized to change. So it's such an important point. Mm-hmm.
And as evidenced by what you guys are saying and working on, women obviously play a very critical role in healthcare. And the U.S. Department of Labor reports that 80% of healthcare decisions are made by women. So I'm curious, though, there's also other research, certainly in the startup world, that points to an absence of women working as entrepreneurs. And Rock Health's primary research found that less than 4% of healthcare CEOs are women. So I'm curious what your reaction to that is and what you think some practical factors might be that are contributing to that trend.
Well, I think it's clear. I mean, obviously, we know it's an issue. I think Amy spoke very eloquently of having empathy for her user when designing something for a parent, and that was what helped her make a great product. And unless we have women in leadership roles in healthcare anywhere, it's going to really be hard to have that empathy for our users and just the diversity you need to have, robust organizations. And I'm sure we could all speak to the limiting factors of why this is the case. I know we were all talking before we came on stage. All of us are moms. We all have at least one child on this stage. Sarah's not there yet, but she will be someday. But the three of us do. And it's hard, obviously, to be a mom and be doing something, whether it's a startup or a social enterprise startup. It's hard to balance everything. But I think for women who choose to do it, I think it obviously really helps make an impact in healthcare because of the unique lens we can bring and the perspective we can bring to shaping this environment.
Right, I completely agree. I also think that it seems very daunting to be, a founder of a startup and to also be running your household, have kids and a family. And I guess the advice that I would give is that from my experience, it has been challenging, but it's been doable. And I think that there are there are specific kind of strategies and things that you can do to make it easier for yourself. So one thing I would say is, as a founder of a startup, it's actually great because it's more flexible. You set the tone for the company, and if you decide that you want the culture to have flexibility, and you want to be able to kind of intermingle kind of personal and professional commitments, you can actually do that for yourself, and you get to enable that for the people that you hire, which I think has been fantastic. So it does mean that you might end up working nights after you put your kids to sleep or on weekends, but for me, that's been the preferred mode. And I think the other thing is, when you're leading a company and then you're also, running your family, there's so many decisions to be made. Some of them are like really important and really critical, and others are just mundane. And one strategy that I've taken is to really try to minimize the number of decisions I have to make on a daily basis. So if I can automate, mundane details like dinner deliveries or groceries, both for my work and for my home, I can just get rid of that so that I can save my energy and time for the most important thing. So when it's at work, it's fundraising discussions with my co-founder, it's hiring decisions, it's product development, feedback with my team. When it's at home, it's being able to actually spend time with my son and not be thinking about all the lists of errands that I need to get done. So I think having strategies like that, asking for help, and having a partner who is very supportive. My husband is a founder of a hardware startup, not in healthcare, but people are always like, how do you guys possibly do that? And my answer is always, it's actually been great to have somebody that I can be completely honest with and get great feedback. So even if we're not in the same industry, there's a lot of similar problems, hiring challenges, fundraising challenges, manufacturing. And so, find people who can give you very, very open and honest feedback.
And I would say it's a little bit different in the global health and international development field. And as you kind of move into the higher realms of leadership there, women tend to drop off for many of the same reasons that you're talking about, but then amplified by the fact that, I, at any given time, have to be on a plane to Bangladesh, to Malaysia, to South Africa, and it is incredibly difficult to balance being a mom, raising a family, and being a leader in the global health field. But the thing that keeps me doing it is that, particularly in the line of work that I'm in right now, I think that having a woman's perspective and really driving the way that these programs get designed and having it be completely grassroots, ground-up program design is so critical and important. And I think that's a perspective that, frankly, is enriched by the fact that I am a mother, and I can bring that perspective. And for me, the balancing act has been in how do I integrate my children into my work. Mine are a little bit older than your two. Mine are 10 and 14, but they've kind of grown up with this work, and I, at least once a year, try to take them on one of my international site visits with me, and then when I'm traveling, they have a better idea. They know where I am, they know what I'm doing, and they understand the work, and it's part of how I'm raising them. Now, if I was in some totally other line of work, I don't think it would work, and I probably wouldn't be able to continue, being at this level. So that's how I've been able to do it, is to integrate them.
So to play off that a little bit, and as a flip side to the question of why maybe there's an absence of women leading healthcare initiatives and starting companies, what unique strengths do you think women do present as collaborators, as people to forge new partnerships, and as people to build consensus in the healthcare marketplace?
Well, for me, I think that the kind of feminine aspects of leadership are exactly what makes us successful in those different topics that you talked about. I mean, when you think about having small children or even older children, you are negotiating everything all the time. You're negotiating putting their shoes on. You're negotiating what you're going to have for dinner. So everything is a negotiation. And many of the same skills that we need as mothers and as women in the world are skills that serve us well when we're trying to collaborate, when we're trying to build consensus, when we're building partnerships. I mean, I manage a partnership with 5 very strong, very independent organizations with 5 differing agendas, frankly. And my job every day is to get everybody onto the same page and on the same vision. And that's not all that different than when I'm getting my kids out the door for school in the morning and I'm negotiating, whether or not my 14-year-old can go to a sleepover.
So let's talk about innovation. In your experience, I mean, you have a lot of expertise in measuring and maximizing social impact. How has your work as an innovator improved and sort of informed your problem-solving strategies, particularly in the non-US market?
Sure. So I think, again, it all comes down to having everything be user-informed. And all of our work, our country programs, we've got country programs in Bangladesh, India, and South Africa. And we have worked to partner with local social enterprises in each of those countries who really do the on-the-ground work. They talk to women and do those constant focus groups and understanding, are our messages understood? Are they resonating with women? Is it in a voice that people are willing to listen to and they trust? So every aspect of our work is driven by user feedback and user information, and that is, I think, probably the most critical component of how it actually works then in the field, is having that perspective.
And I would just add, it's a great question about innovation. I think innovation springs from a problem you are really passionate about, which we all think clearly share that. And for me, I don't tell this story a lot. This gets to being a woman who's a business leader and wanting to seem like I'm tough as nails and not emotional. But I started this company in part because I had a problem with staying pregnant. I had multiple miscarriages, and by going through that, and I had trial and error to figure out what was wrong. Despite the fact that hundreds of thousands of women have the same problem every year, we still don't really understand what causes recurrent miscarriage. And I thought there's got to be a better way to help women navigate this whole reproductive health area, and that's part of what inspired Wildflower Health. But my point is that I think, to really build something innovative, you have to have that deep passion and really understand and see this problem that's just visceral and economic and social and everything else. But to me, that's really where innovation comes from. And unless we have women really connecting and solving problems in leadership positions, we may not solve some of the biggest problems that plague women.
What challenges would you say were sort of most insurmountable in the last, sort of 2 years for you, starting a company?
Well, I started this company when I was 6 months pregnant. So that in and of itself was a challenge, just dealing with becoming a new mother and being a first-time founder and CEO. But I would also say it made me better. because I did have to learn to prioritize and negotiate, and had deep, deep empathy with my users, obviously. And I would, I think Kirsten spoke eloquently of the contribution women make as leaders being consensus-driven and collaborative, and that style of leadership I think is great. But I also have found, as someone who's raising money for a venture-backed startup, the natural style of leadership from women can sometimes work against you in a field like venture capital that's very male-dominated, and where the MO for fundraising is very, very aggressive. And so I've had to learn to balance, being authentic and being true to myself, not just as a woman, but just as Leah Sparks, and navigating that whole world, which has a different culture. And I think that there's more women getting involved in that field, and the culture will change over time. But I would, that's definitely put it on the table, definitely a challenge in the startup world.
Definitely.
Yeah, I would agree with that. I think some of CellScope's biggest challenges to date have been related to fundraising. When we were initially trying to fundraise, it was very hard. And the digital mobile health space is still relatively young, but it has come a long way in the last few years. And I think we were kind of on the early end. But it was like, when we talked to traditional medical device medtech investors, they were very skittish about unproven business models for mobile health. And then when we talked to the traditional tech investors, they were very concerned about regulatory and FDA and, how are you going to get past those hurdles? So I think one of the strategies that I've had to learn and continuing trying to improve on is to utilize different leadership styles depending on the situation. So like Leah referred to, when you're pitching and you're in a boardroom, usually as the only female in the room, you do need to be a bit more aggressive and lean in more. And I think there's a time and place. There's an interesting HBR article that talks about different leadership styles and how actually the best leaders are ones that can mix and match the style as needed on the context and the situation and the actual people that they're working with.
And Amy, moving into a little bit more about sort of the CellScope product, as a female engineer, do you have any sort of perspective on what it's been like to build a product that's designed mainly for parents and children as a mother as well?
Sure, yeah. So I can talk a lot about ear infections in particular, because that's what we've been focused on. But as a parent, I know that right now, whenever I suspect my son has an ear infection, it's such a pain, and I deeply feel and understand that pain point. So usually it's at the most inconvenient time. It's like after work at night, or it's a Friday or weekend, or you're about to go on vacation when your kid is sick. And right now, there just are not great tools for consumers to have in the home. My only options currently are, I could take my child into the ER. I clearly don't want to do that. The last time I took my son into the ER, I got hit with an enormous bill, and that's with good health insurance, so that's a whole other topic. But otherwise, I can wait till the next morning and try to squeeze in a last-minute appointment into the pediatrician's office, take half a day off of work, schlep my child and all his stuff, expose my child to germs at the doctor's office, all so that the pediatrician can take, a quick peek into his ear and then give me a diagnosis and a prescription if necessary. And at CellScope, we just think that this needs to be disrupted. Like, there are just better ways to do this. We really believe in, the smartphone is enabling, it's ubiquitous, and people are starting to build, really powerful tools that people can have, and we can start, enabling consumers to have more options. As a parent, the worst thing is a sick child that you don't know what's going on. You want that peace of mind, and you want it as quickly as possible. And so, envision a world where instead, when you think your child might be sick, maybe ear infection, maybe a weird insect bite while you're on vacation, you can take one of CellScope's devices, attach it to your phone, take a quick video, and then transmit that and get it remotely diagnosed. One thing we've learned is that even for like follow-up exams, this could be very powerful. So typically with an ear infection, you take your child in for the first visit, and then if you go home with a prescription, that usually lasts like 10 to 14 days. It's total black box as to what's happening over that time period. You do your best in terms of administering the medication, but you don't know really if your child's ear infection is getting better. You can kind of look at the symptoms if that's improving. But imagine if you had the CellScope Oto at home and you could actually take a picture, say once a day, or maybe twice a day. And you're going to start to build this library. You're going to see more and more data. And at CellScope, we think this is incredibly powerful. You take something that right now that's very like initial visit with the doctor, and then maybe you schedule a follow-up visit at the end of the antibiotics course, and you have those 2 data points. And remember, those are the only 2 data points, and it's in the doctor's head, because the doctor has no digital record of what the ear looked like. It's just the doctor kind of looking in real quick. So there's so many advantages to being able to have tools like ours, being able to have that digital record, being able to have more data, starting to look for patterns within the data. Maybe amoxicillin isn't working for your child for this particular bacterial or viral infection. Imagine as we get these devices out into the world and as we start getting more data, being able to look at interesting trends, like what does an ear infection look like in New England in the winter versus in humid Texas in the summer versus in temperate California, and then if in other parts of the world even. So I think that right now there aren't great options for consumers, for parents, and as more diagnostic tools like ours become available, it's really going to be empowering to enable parents, even if it's not always a remote diagnosis, but potentially, a way to monitor. There's a lot of doctors are pushing for watchful waiting, where if they suspect an ear infection, they don't prescribe antibiotics right away, because actually the majority of the time antibiotics are not of use. So it's being able to actually see the ear every day and be able to see if the ear infection is actually doing better or worse. And so I think that's how tools like CellScope are gonna change this.
Definitely agree that these sorts of tools are going to allow for disruption and more patient engagement and empowerment in the healthcare space. So shifting gears a little bit, there's a lot of knowledge and expertise on the stage, and I'd like to get into a sort of more philosophical question around the clinical landscape. There are obviously gaps in both the global and US markets in healthcare and care delivery. So I was wondering if each of you could sort of speak through your specific lens to what gaps you see and how you personally might be trying to solve them, and any other information you might want to sort of provide as texture around those issues.
Sure. So in the international realm, particularly across the developing world, I mean, it's a critical shortage of healthcare workers. In fact, I saw some statistics that there's an estimated need of over 700,000 more healthcare workers across the developing world in order for us to be able to meet our Millennium Development Goal targets related to health. One of the things that we know, particularly around childbirth, is in Southeast Asia and Africa, less than 50% of the births are attended births, either even by a traditional birth attendant, let alone by an actual doctor, compared to about 95% in the United States. Another thing that we found was that in Chicago, there are actually more Ethiopian doctors in Chicago than there are in Ethiopia. So these are all just a few kind of startling data points around the clinical landscape across the developing world. And while MAMA doesn't specifically address that from the clinical perspective, we address it from the perspective of we're educating consumers, and we're seeing now that consumers are putting more of a demand on the system, and at some point the system's going to have to rise up and meet that demand. But on the other hand, there are a lot of innovative programs out there that are coming up through the global health and international development community that are particularly focused on the use of mobile phones to educate and empower frontline health workers. workers. And I think it's that kind of cadre of frontline health workers to have them have the tools that they need in their hand, and maybe someday they'll have CellScope in their hand as well. But there's a variety of tools that are now accessible from diagnostic as well as educational tools to help the frontline health workers and help them provide better clinical care than we've been able to see in the past. But there's lots of different aspects to that, and it's a complicated landscape, but the bottom line is there just aren't enough trained and educated workers out there to meet the demand in the developing world.
Yeah. And I think in the United States are obviously issues that have a different nuance, not as much, maybe not as much the access problem. I would characterize our challenges in the United States as quality, cost, and data, which is sort of a center point between the two. And on the quality front, it takes decades for evidence-based care to be integrated completely into all doctor practice. We have huge inconsistencies in the quality of care. So we just did a survey of the C-section rates at hospitals in Silicon Valley for one of our clients, and they range from 25% to 45%. The best practice target's 15%, by the way. But it gives you a sense of the ranges of inconsistency we see in healthcare. And on the cost front, the Affordable Care Act is helping us mitigate some of the challenges with cost, but it's still an issue, and that's probably our barrier to access the United States. And then what I would characterize as the sort of common denominator between these two is data. We have a very disaggregated healthcare system, many different health insurance providers and payers, and the data lives all over the place. So it makes it really difficult for us to harness data to have real-time, smart, evidence-based decisions that improve that quality, reduce that inconsistency, and improve the cost. And we really believe at Wildflower Health that the one kind of common way that you can change that is actually empowering and informing the patients. The patient is the one person who's there in all those realms. If the patient's aware of all the new free preventative screenings available under affordable care, she can tap into it. If the patient's aware of what the evidence-based treatment is for having a history of preterm birth, she can ask her doctor about it. So we actually do believe that engaging patients is not just big for marketing to make them feel good, but it can actually change healthcare. And also, when you get all that data from patients, you can really start to connect the dots and make the healthcare system smarter. That's our philosophy and our lens.
Yeah, and I'll just add to the engaging the patient part. We've been testing prototypes with doctors around the country, and one of the values, one of the benefits that they really see with the CellScope Odo is being able to so much better engage with the parents of their patients. So these are mostly pediatricians and family practitioners. But the doctor's feedback to us has been, it is so different to be able to use your otoscope and actually then turn around and show the parent, the video of the child's ear, and actually be able to explain, this is why I've made this diagnosis. This is why I'm not prescribing antibiotics, or this is why I am prescribing antibiotics. And so just having them be informed and just feel more engaged in their child's health has been huge. And actually, we've also found out that oftentimes parents will bring not only the sick child, but also some siblings, and the siblings clamor for getting their ears checked too, because people have never seen this before. Parents have never seen the inside of their own ear or the inside of their kid's ear, so it's incredibly exciting. And so it's taking something that only the doctor was seeing before and actually allowing the parent to be part of the discussion. I remember my son's pediatrician looking in his ear and then pointing to a black and white photocopy of a sick ear on the wall and saying, his ear looks like this. It was so different when she could actually turn it around and show me his actual ear.
So I have another question that sort of just came to mind, and Kirsten, you might be the best person to sort of initiate, a conversation around this, but some questions that people who work in technology often get are around how does technology actually help the underserved? So I'm really curious to hear what the perspective around technology might be in communities outside the US, and are we talking specifically about mobile smartphone technology, texting, that sort of thing?
Well, I believe really deeply that the technology, for it to actually help the underserved, has to be appropriate to the population that you are serving. And this stems from literally my Peace Corps days in Mali. I remember walking down the street in rural dirt roads in Mali, and there were farm equipment and things like that were just like littered, rotting, rusting by the side of the road. And it was technology that organizations thought would help them. But it wasn't appropriate. They didn't have the parts to fix them. They didn't know how to fix them, things like that. So the minute something broke, it was just rusting by the side of the road. So, fast forward 20 years, and here we are with mobile technology. And while it might not be rusting by the side of the road, if we're not designing appropriate technology, then it's just not going to be used. And in the mobile space, there are all of these amazing apps and all these amazing things that you can do with smartphones and access to data and all of that. But the reality of the users that we serve is they don't have a smartphone probably. They probably have some really old, Nokia knockoff from many cell phone generations ago. And we've got to have a program that we can deliver information to them on that phone, not on a smartphone app. So it's just so critical for technology to actually serve the underserved. It has to be designed and with massive input by the population that you're trying to serve. And it can't come from our Western brains of like, hey, isn't this cool? We could do this. And yes, the technology can do it. That's the easy part, frankly. It's the cultural and the people part that is much more difficult than the technology part. And so bridging those is what makes it, that's the critical success factor of, is this something that people are actually going to use, is going to change their lives, is going to make a woman breastfeed exclusively, to access family planning commodities, those kinds of behaviors, or is it something that's going to be rusting on the side of the road?
Yeah, I think it even applies in the United States too, though. I mean, I think we live, Amy and I are both in Silicon Valley. I know you're on the East Coast, but in Silicon Valley, we design a lot of things for people in Silicon Valley, and I think that's one of the biggest challenges we have in healthcare startups is how are we going to scale? How are we going to really get scale for these great innovations we're developing? And in our company, again, part of the reason we decided to start in pregnancy is, and we're designing on a smartphone for Android and iOS, our mobile programs available that way. But we're starting in pregnancy because we know even in Medicaid, almost 80% of women have smartphones. And we're writing our content at a 4th to 6th grade literacy level. And our first launches are going to be for a Silicon Valley employer and for this sort of mountain state Medicaid population. And I think it's going to be awesome to, knock on wood, really test this in two very different populations. Because to have satisfaction as an entrepreneur and to have a successful business, you've got to really be able to impact the broad population in the United States. I think it's relevant here as well.
Yeah. So, sort of playing off that and talking about the U.S. Marketplace, we're obviously going to very soon see these new healthcare exchanges where consumers can shop around for health insurance. What role do you think women are going to play as the obvious healthcare decision makers in the family unit, as we've discussed, in sort of shaping and framing those exchanges?
Well, I'll take a stab. I mean, so my company sells to health insurance companies, including health plans. And I've worked in healthcare for a long time with the healthcare payers. And I'm starting to see, just whether it's coincidence or not, I've seen a few high-profile women take roles as sort of head of consumer initiatives in some major health plans, including one of my old bosses is now running it for Cigna. And I think that there is a recognition by the large healthcare plans that women are big influencers. And with health exchanges, they do need to start thinking more significantly about how they market and reach consumers and are more friendly to people who'd be their members. Historically, healthcare has been really bad about communicating with consumers, engaging consumers in a real way. So I think at a business level, the executive level, you're starting to see that acknowledgement. And I think, once the exchanges are live and this proves out even more, I think we'll hopefully continue to see that even more, that attitude.
So, I have one last question before we open it up to the audience, in case you guys have any questions. Mentorship has been identified as something that's often missing in, not just the healthcare, but just the business landscape overall for women to advance their careers and learn. And so, for all the sort of, social entrepreneurs out there, the double bottom line folks, I'm curious if you guys have one or two just pieces of advice, guidance, general tips or anything about your bold visions for healthcare or for everyone out there who's working to make the world a better place.
Well, to me, one of the reasons I can do the job that I do is because I've got an amazing team of young women behind me. And I take my role as a mentor and a leader to them very seriously. And a big part of that for me is, I think, what women tend to have difficulty with, which is stepping back. So there are times where I need to step back and let them take on leading roles, supporting them in those, but to acknowledge, you know what, I can't do everything. I have to admit that I can't do everything, and I can support them in going to meetings that I maybe can't attend. There was one that I had just last week that was, a major corporation and CEOs and all of this, and it was a fundraising thing, but it was on my kids' first day of school. And I couldn't miss my kids' first day of school. So I sent one of my senior managers, who's a fantastically talented young woman, to it, and really tried to support her in that. And it was hard for me to do, but it was totally successful. She got a really great opportunity, and I was able to say, you know what, I can't do everything, and somebody else can do these things. And I think as women, we have to say that more, and realize that supporting other women in taking on leadership roles isn't threatening to our own, but really just helps us all, Yeah,
I think the one thing I would say, and this has been kind of an aha for me in the past year, becoming a new mom and becoming a first-time founder CEO, is anytime you do something new, whether it's starting a company, starting a new relationship, starting a new initiative in your work, whatever, writing a controversial blog post, you're putting yourself out there. And it's never comfortable to really put yourself out there and feel totally exposed. But it's the reality, right, of life and growth. And I think particularly as women, there's all these studies that show women always wait to make sure we've got everything lined up before we ask for the promotion. And we want to, have all the checks in the boxes before we do whatever. And I think we have to push ourselves maybe even more than men sometimes to get ourselves and be comfortable being out there. And when you do it, you can really enjoy it, because that's how you really know you're being true to yourself. But not to be overly philosophical, but that was, that's what I would say is getting really comfortable with that level of vulnerability and being out there would be my piece of advice.
Yeah, I think that's a great one. I think at an early stage startup, you need to take risks and be scrappy, be creative, think of, alternative ways of doing things. CellScope, we were lucky, but we were able to get our prototype onto the Colbert Report a couple of months ago, which was like a huge, marketing PR coup for us. But the cool thing is that we did it by ourselves. We knew that Dr. Eric Topol, who's a leader in the mobile health space, was going to be interviewed by Stephen Colbert, and we also saw a tweet that Colbert had tweeted out that said he had punctured his eardrum. So we basically just contacted Dr. Topol and overnighted him, at the time, our only engineering prototype, and he was able to get it on. And so I think that's experiences like that just are such a good, powerful reminder to me that when you're doing a startup, especially one that's healthcare driven, or one that has an exciting mission that people can rally behind and get really excited about, it's truly amazing what doors will open for you. You get so much more recognition working at a startup than, or at least in my experience, than I ever did working at larger companies. And so that's really exciting. If as a founder you get invited to speak on panels, and sometimes it's maybe I feel a little bit uncomfortable, but I found that by saying yes, trying to give back to the community, trying to, putting myself out there has just reaped benefits, both for me to develop personally and professionally, and for my company. I think the other thing I would say is people. Surround yourself with really great people, starting with your co-founders. Find people who share the vision that you have, and that you can work well together, and preferably have complementary skill sets. I have a fantastic co-founder, and we've gone through extreme highs and extreme lows together. And then together with your founding team, take the time and energy to actually build a very solid team around you. And CellScope, we're currently at 7 people, but every single person we've hired has made an incredible impact, even from the first day of hiring. And so my founder and I know that those were the right decisions. And when you hire good people, it's amazing how quickly things can scale. Even with just 7 people, how much we've been able to accomplish.
Colbert Report, that's very industrious marketing and free advertising for you.
Yeah. Yeah, I have a tough time saying yes to PR firms now because we were able to do that on our own.
I'm sure. So I'd love to open up questions from the audience now. I know that Amy, Leah, and Kristen are very eager to address any questions you might have. Is there anyone who wants to ask anything? It's for the gentleman here.
Hi, thanks so much for this. My wife is actually starting as a public health nurse with Black Infant Health down in East Palo Alto. And I think I'm absolutely going to check out both your apps and your program there as additional tools for her. But I know something that she's commented on is, she's received years and years of training, but there's so much new technology and new information coming out that can really help to empower her clients. The difficulty for her and for me is, hopefully being a new parent, is just really finding a good place where I can access all of this information and get an idea of really where to start, because there is so much out there. Can you speak to existing resources for people who are starting off? Maybe they have some relationship with a healthcare practitioner, but really want to take a higher level of engagement in their own family's health. I mean, I know, of course, your app is one resource, but for instance, where do you do your market research to figure out who your competition is, that sort of thing?
Well, I'll just dive in. I think part of the reason we started this company is I did the market research and didn't like what I saw. I think you bring up a great point, is that it is a little overwhelming. I'm sure from your wife's perspective and just as a parent, I feel like I'm often just lost online or even on my mobile phone trying to figure out answers to questions about my son or his health or what have you, and I work in this space. And what we saw when we started Wildflower Health, so what we're doing is actually integrating and customizing, configuring our program based on either the hospital, the health plan, the provider, and it's almost like, I think it was the difference between the Mint.com app and the Bank of America app I use. Getting it, the distribution channel for getting our program is actually through the health plan or the hospital or the doctor, which I think is something that's really, really missed so far in healthcare, is distributing things to consumers that are credible because your doctor told you about it, or the nurse, or you got something from your healthcare system about it. That's something I think we've really missed, because I think that's part of the reason consumers are lost, and that's definitely a problem we're trying to solve. But I don't really have any advice of resources I use. Do you, Amy or Kirsten? Again,
Well, I think the same question gets asked to me all the time, but with a slightly different spin, and that's from organizations who want to implement mHealth programs globally. And it's the same kind of where do I go? Where do I start? Where do I look? With Mama, we've got tools and resources, particularly for the MNCH mobile messaging services. Our content is available. We've got a monitoring and evaluation framework, things like that. We're building out more tools all the time. But there's also, in the international development mobile health space, there's the mHealth Alliance, and they tend to be kind of more of a convening place to go. And I don't know if that kind of a correlation exists for these kind of consumer apps in the US and developed world markets.
I think we'll get there, but I don't know that I have a good answer. Sorry, I don't have a good answer yet.
Yeah.
You just have to keep Googling, I guess.
Hi, I represent a social sector focused strategy consulting company. We've recently been hired to look at the reproductive rates in Niger. And we're going to be consulting on ways to influence women to use modern contraceptives. And we know that interviewing women alone is not enough. And similar, Kirsten, to your video, where your messages also appeal to the mother-in-laws and the fathers, we also know that incorporating men into our efforts is going to be extremely important. So Specifically in Mama's case, but if either of the other panelists have something to add, I'm curious, how often do you also take into account the men in these women's lives and the other role players who have major influence, and how do you balance the messages that women need to receive, whether it's in opposition or in line with the messages they're also receiving from the men in their lives?
Sure. So we found in many of the cultures where we work that this was critical, that we couldn't just have a mama service. So in Bangladesh, for example, as you saw, what we found was just having a few messages interspersed that were directed to the father just wasn't enough. Having the father sign up for the exact same service wasn't enough. They wanted something for themselves. So in Bangladesh, we actually have 3 sets of complementary messages. We have one that the mother can sign up for. We have one that the father can sign up for that actually refers to him as the father and talks about his role, and it's complementary to the messages at the same time that the woman's receiving, and then the same thing for the mother-in-law that actually speaks to her as the mother-in-law and her unique role in the family situation. So I highly recommend that as you're looking in Niger or any other country where you happen to be working, this is again going back to my point that I've been saying over and over about really getting out there deep into the field and talking to your users and understanding their familial context. And so our global framework for messages are available on our website for organizations who want to download them. And we also have guidelines for how you localize it, and we highly recommend that you bring in the Ministry of Health, you bring in the traditional birth attendants, you bring in all the different people who are working with your target demographic, because only they are really going to be able to give you that insight for how does the family dynamic in that particular culture shape the way the decisions get made, and then how do you need to adjust your messaging accordingly. It's critical.
Do we have any additional questions?
Hi, my question was going back to the summary of the topic for this talk, where 80% of purchase decisions or health decisions are made by women. What form do you see as the best to empower and educate those women? How are those women getting educated? Because, you know, I don't know how many mothers, I don't know what the data of the Colbert Report is, but I don't know how many mothers watch the Colbert Report versus young guys. And when you're talking about mobile applications, I work in women's health, and getting women to use mobile apps, and particularly mothers, it's not necessarily the ideal demographic. For example, we've worked with QR codes, and getting anybody to use QR codes in the United States is a challenge to empower and educate them at point of sale. So I'm just sort of trying to get any data or insights that you guys have on, if women are the ones who are making 80% of the decisions, where are they getting this information to make the decision on? Is there ways that we can deliver information, or, you know, that is the most effective way to get to ladies to empower them?
Well, I can start. I mean, I think, you know, 80% of women making the decisions is a big demographic, right? Because you've got like, you know, older women who maybe have older children who are making those decisions about where to send them to the doctor. You have young women who are getting pregnant. So, you know, it's going to obviously depend. The answer depends on your demographic. And, you know, so I think it's different depending on who you're targeting and what condition and what type of decision you're targeting. You know, I can only speak for pregnancy because that's the demographic we're focused on right now. And as I mentioned, you know, they do have smartphones. Over 80% of women in that demographic do have smartphones. But in terms of reaching them, you know, and this again, something healthcare hasn't really done traditionally, but so when we're launching in this Medicaid state in a month, we're not just going to do the traditional send you a letter in the mail about this new program and, you know, all the stuff that healthcare's traditionally done. We're actually going to do a real consumer campaign. We're going to be on Facebook, on mobile advertising, on online advertising. I mean, we do know that pregnant women, particularly early in pregnancy, have this huge spike in online and mobile research. Their data is there. And so we're meeting that audience where they are, on their phones and online, to reach them and draw them in. And then we have an app that's very sticky, and women continue to use it throughout their pregnancy. But I think, you know, the answer to your question is going to be different depending on which demographic and what decision you're going to target. There's not just a global one-off answer.
I think for CellScope, we're kind of taking a two-phased approach. So we're initially starting with physicians, and then the idea is that physicians using it in their clinic, we're getting interesting data, we're learning a lot from the physician, but all the parents, who come in with their kid are going to see the physician using it and be amazed, and what is that? Cellscope Odo, wow, that's so cool. Can I get one? I mean, we've already experienced this with some of our early testing doctors. So kind of pushing, through the medical professional channel, and then in parallel doing kind of the consumer campaign that Leah talked about, being on social media, targeting, for example, there are different parent groups out there that have specific medical problems. Parents whose kids have cholesteatoma, which is an ear issue. It's amazing, like if you can. When you tap into a pain point that parents have, they've formed groups around it to support each other, and I think the key for us is finding those, maybe starting in the niche, for those people that have a serious pain point, and then from there going mainstream. I think. Never underestimate the power of word of mouth, too, between parents. I mean, speaking for myself as a mom, I pretty much, whenever I have a question about something, there may be a couple of kind of websites that I do go to, like Baby Center is one that comes to mind. But in general, the fastest way for me to get a very good answer for myself is to just email or call a couple of my close friends who have kids.
So we have time for one more quick burning question.
I guess my question is that it's about the physicians, and as a consumer who is a little maniacal, I'll collect opinions from multiple pediatricians on issues, including a pediatrician in the UK, and the advice is dramatically different. And I think pediatricians, particularly in the US, and doctors in the US, they tend to practice out of fear and that they believe their consumers are ignorant. And so with your startups, which are educated consumers going into the doctor's office, how are you going to, or how do you see that changing or not changing?
Yeah, so is the question more around kind of the physician pushback, physician concern, because we're trying to educate and engage consumers?
I think it's about
how to deal with
international guidelines, or?
Sorry?
Are you asking about the difference between international guidelines?
I'm mostly interested in the US physicians because I think they're the ones who actually practice in a fear-based mode, and they treat their consumers as if they're incapable of anything. And that's the medical advice that they give to people.
From Cellscope's experience, from the doctors that we've worked with, there's a range. Yes, there's always going to be some that are the physicians that are more traditional, have no interest in using tools like ours, and want to kind of keep practicing the way they've been doing it. But we've actually been pleasantly surprised by how many of the doctors out there, especially the younger ones that are coming through, they're already using apps on their phone, to explain things to their patients. I actually haven't come across that many physicians that are like, I want to kind of withhold information from my patient, because I think what they found is using devices like ours can actually make the whole experience for them better, because they have an easier time, either calming down a patient, getting, like one doctor, for example, was having a really difficult time with a patient who desperately, she had some ear pain and wanted a referral to an ENT. And this was a family practitioner that we're working with. And he said, in the past, I probably would have just caved, even though I know she doesn't need to see a specialist, which of course adds cost to the healthcare system. But he said with a device like ours, he was able to actually show her ear, which kind of calmed her down, and she was able to then say, okay, I'll just, kind of wait it out and see if it goes away, and it did. So I think in our experience, it hasn't been too much pushback there. I think where we do get pushback from doctors is it depends on the type of system that the doctor practices in. So for all the docs that practice in like capitated systems like Kaiser, they're salaried, their incentive structure is to reduce the number of unnecessary office visits. So they love technology like ours. For the physicians practicing in private clinics, fee-for-service, traditional insurance reimbursement, there we'll get some of the, this is really cool, like, technology, and, it would be amazing to be able to provide this service to my patient, but how am I going to get paid? Is insurance going to reimburse for this? We get all of those types of questions, and then, it looks like maybe someday you won't, I won't be needing to be in the office as much with tools like yours. So I think that's where we hear more of the concern, not so much on, I'm afraid of kind of showing my patient more information.
I think we had a final burning question here.
Yeah, thank you very much. I'm Gary Crane. I'm a PhD psychologist and a co-founder of a web app that's the first science-based app to help couples have happy, stronger marriages and committed relationships. And there's a lot of research showing that keeping couples in strong, happy relationships is every bit as predictive of lower rates of coronary disease and cancer as is diet and exercise. So I'm wondering if you know anybody that would like to see technology start moving more in the direction that we're trying to pioneer, and to what extent you think that's possible to happen. I mean, we have 17 years of technology and nobody's any happier. And I think the reason for that is once you've got food in your stomach and your roof over your head, the main predictor of happiness is how well you love and are loved by those closest to you. So I'm wondering if you know anybody that would like to help us pioneer what we're doing.
Is there a company called CoupleWise?
Yes.
Heard of you.
I would just say I think that you're onto something. I mean, I think that the level, like stress and emotional well-being, is one of the least acknowledged and least supported conditions that we have in healthcare. And part of what we're doing in Wildflower Health's program Due Date Plus is women are telling us how they feel emotionally and their level of stress. And we have a little tool in the program that's a centering tool right on your phone that is based on science. Around 20 seconds is about time to release endorphins. And we're going to be capturing all this data and looking at it, because I gotta believe that impacts pregnancy outcomes. And so I say, go for it and applaud you. And I think we need more of that in healthcare to have a truly holistic healthcare system. So.
And for us, actually, that's integrated into the philosophy around our messages. You mentioned Baby Center, and Baby Center is one of our partners, and we work with them on our content. And a really critical component of our content is that we're not just giving women kind of factual information, but it's this delight factor. And we give them information about, your baby's the size of a pea right now, or, we know you're feeling very tired at this stage, and here's ways that you can ask for support from your family. And those emotional and encouraging factors, I think, are one of the most critical reasons why women are reporting to us that they not only listen to the messages, they look forward to the messages, and they trust the messages, because we're not just giving them factual information, we're addressing the emotional issues, and we're supporting them. And that's so important.
Well, thank you for joining us, and thank you to our incredible panelists for your time and your insights.
Thank you. Thanks.